Hi, this is Dr. Schmoe from the Functional Neurology Center, and I'm going to review through the process of setting up a virtual one-on-one telehealth visit with me. We all know that there's uncertain times right now with what is going on in our world, and I really believe that by performing telehealth examinations with new and existing patients, that we can start to uncover what's going on with people and get them moving in the right direction with their neurorehabilitation. So we see patients with post-concussion, dizziness, vertigo, migraines, movement disorders, cognitive disorders, and we basically activate their systems non-invasively with different types of sensory stimulation. So with that basically means proprioceptive feedback, activation of your body coming from your muscles, combinations of head and eye movement exercises, gait rehabilitation, vagal nerve stimulation, other manual therapy techniques that I think that many of these can start to be performed at home to hopefully start to trial to see if we can start making improvements with you and then see where we can get through that process. So number one, we're going to set up an initial patient consultation. That's going to be performed by my patient care coordinator. You'll be able to sign up through Calendly and then schedule that consultation. We just want to make sure that based off of your symptoms and what's going on, that we think that we could possibly help you with our virtual program. We obviously don't want to work with patients that we just don't think that we're going to be able to help them, so we want to make sure we're a good fit and that you're a good fit and that we can actually make some changes doing some exercises at home. So that's the initial step. Based off that information gathered, we'll decide if we set up our initial virtual examination. And even prior to that, we are going to send you, basically it's a to-do list of things that you're going to complete prior to your exam. Example would be, we need to check your blood pressure. We're going to do it lying, seated, and standing, and we're going to do it bilateral. The next thing that we're going to do is we're going to look at your heart rate, and we're going to look at that lying, seated, and standing as well. Why are we going to do that? We need to assess what's going on with autonomic function. Your autonomics are basically a reflexive system neurologically that ensures that you get blood flow to your brain, into your gut, into all your organs, into your limbs, and commonly with neurological dysfunction, your autonomics they're definitely off, and there's changes in your sympathetic and parasympathetic balance, and we can start to uncover that. All right, the next thing that we're going to do is we're going to take a look at what's called red saturation. So we're going to cover up one eye and take a look at a red color on your smartphone or tablet, and then switch to the other eye and just see if there's any changes in the color red between left and right eye. We see changes in our migraine patients, our patients with post-concussion and autonomic dysfunction. It's just another way for us to start digging deeper into your autonomics. All right. After that, what we're going to do is have you, we're going to look at, can you keep your eyes steady on your thumb? So we're going to have you arm's length away, keep your eyes steady on your thumb for 10 seconds, and we're going to have you note, do you feel any dizziness or lightheadedness? Do your eyes feel like they're drifting, or are they moving around? Do you have any double vision? And we're going to have you do that to the right, to the left, up, and down 10 inches in each direction. After we do that, then we're going to have you close your eyes. So we're going to have you close your eyes for 30 seconds, and then we're going to have you basically feel, do you feel unsteady? Do you feel dizzy? Do you feel floaty? And we're going to have you write all that information down. The next thing that we're going to do is have you tilt your head to the right, and you're going to do the same thing. Do you feel dizzy? Do you feel any spinning sensation? Do you feel lightheadedness? Do you feel anxiety? You're going to perform that to the right, and then you're going to perform that to the left side as well. So by doing these different tests, we can start to look at, are there any changes that are going on? Eyes open, eyes closed. Is this an issue that's going on with your eye tracking? Is it more of an issue with your vestibular system? Is it central? Is it peripheral? And by doing this, we can hopefully start, figuring out neurologically underlying what's going on. What we're also going to have you do is download an app. It's called Brain EQ. And we're going to have you perform the initial assessment. It takes 13 to 15 minutes, and it looks at a variety of different neurological functions. So it's going to look at your balance. It's going to look at how rapidly your eyes can scan and look at your saccades. It's going to look at cognitive function. It's going to look at memory. It's going to look at word recall, and it's going to look at your symptoms. So it's actually going to have a symptom tracker that will basically tell us how many symptoms do you have and what is that rating scale. So by looking at that, looking at the other data from Brain EQ, combined with other simple tests by looking at autonomics and looking at eyes open, eyes closed, we can start to dig deeper into what's going on with you. And that's what you're going to do prior to your initial examination. During your initial exam, we're really going to dig into your history. So we're going to look at what happened, how many injuries did you have, what are the mechanisms of the injuries, and just start figuring out, is there any underlying neurological dysfunction, metabolic dysfunction, and structural issues as well. During your initial exam, we're going to have you palpate different nerve spots, basically. Here's an example, one we called Erb's Point, which can give referral up into the head and neck and into the shoulder. We're going to look at supraorbital nerve, supratrochlear nerve, suprascapular nerve, and we're going to actually have you palpate these nerves yourself. And we're going to look at all the superficial cutaneous nerves that are located right underneath the skin that can become inflamed or have neurogenic inflammation. It's very common with trauma and whiplash. So we're also going to be able to teach you how to do some manual techniques on these nerves yourself. We're going to uncover, are there any issues with combinations of head and eye tracking, any issues with vestibular reflexes in this plane, and the roll plane. And we're going to have you walk. We're going to look at your balance. We're going to have you march in place and see if you rotate one side to the other. We're going to have you do rapid alternating movements and look at things like finger to nose testing and look at cerebellar function. And based off of all of this information, then we're going to start designing some at-home rehab exercises for you to start completing. For example, say if you were off on one side compared to the other side, those would be different exercises compared to somebody else. So by looking at these functions, we can start to figure out what you specifically need from the comfort of your home. What can we do in terms of therapies and exercises from home? Well, one of the things that we can have you do is work with different gait strategies, different balance exercises, combinations of head and eye movement exercises. We have different apps that we can use. One of them is called Focus Builder, where we can program in specific exercises based off what we think is going on with you. And we can work on smooth pursuit, quick eye movements, optokinetics. We can work with basically metronome to work on rhythm and timing. We can teach you how to do other non-invasive things like gargling and trigeminal stimulation from your home. We can even drop ship an at-home PRS ARP wave directly to you and perform at-home direct current and microcurrent stimulations to activate different points. We can also run labs, and we can look at underlying issues that might be going on metabolically. So we could have issues with vitamin D levels. We could have increased inflammatory markers, changes that are going on immune-wise. So look for immunocompromise that might be going on. We can look at food sensitivities. We can look for GI infections. We can look for parasites. We can look at anything that's going on metabolically through different labs that we run by drop shipping kits directly to your house, and even performing some salivary diagnostics directly from your house, and some tests that we can have you complete where you do have to go to a lab. So by looking at all things neurological, structural, and metabolic, we can start working with you from home and get you moving in the right direction and hopefully make some changes. If we do decide that you need to come to the clinic, then we do offer a 15-hour intensive neuro rehab week program. We also have programs that are less intensive for local patients. So even if you're local, you can still start with a telehealth examination if you don't feel comfortable leaving your house right now. So there's multiple options for me to continue working with people. And I think that it's going to be great. I think we're going to help a lot of people, and we're going to do it safe, and we're going to do what's right, and we're going to do what's specific for you. So I'm looking forward to working with you. And if you have any questions, you can send them directly to me as well at drschmoe@fnc.com. Thank you.